A Texas lawmaker is sharing a personal story as he leads an effort to cap insulin prices for diabetics. State Representative James Talarico revealed he found out in 2018 he had type 1 diabetes after being hospitalized on the campaign trail. His first month's supply of insulin cost him close to $650. So the Williamson County Democrat crafted House Bill 40. It would cap out-of-pocket costs for insured Texans at $50 per month for insulin. The bill has bipartisan support, but not everyone is on board. Opponents say the fix should target drug manufacturers rather than insurance companies.
So our big problem with this is that nothing's actually being done to lower the price of the drug. We've seen it go from $20 to almost $350, $400 a vial for Texans and Americans, where in other countries like Canada, it only costs $30 a vial. So it is important to lower out-of-pocket costs for Texans, and we're already doing that. But having a government mandate to do that potentially raises the cost of health coverage.
Insurers are backing a different bill, House Bill 18. That one would have the state and health insurance companies leverage their influence to negotiate lower prices from drug manufacturers. Joining us for Insight is Representative James Talarico. Your bill to cap out-of-pocket costs for insulin has bipartisan backing, but there are critics. How do you respond to those who say you should focus on drug manufacturers instead of insurance companies?
Well, I think we have to do both. This is a complex problem, but it's one that needs to be solved from a variety of different angles. But the blame doesn't just fall on the manufacturers. In some cases, insulin products have actually decreased in price, yet out-of-pocket costs have increased over the past few years. So health insurance companies also carry some of the blame with this problem. And so that's why our bill is focusing on out-of-pocket costs, but we also have HB 18, which is helping to provide discounted prices for uninsured Texans. So this is an all of the above approach where we are attacking this problem from multiple angles.
Your personal story surprised a lot of people, I think. Tell us how you discovered you had diabetes.
Yeah, in May of 2018, I was a healthy 28-year-old running for this seat that I now hold. And I decided to walk the entire length of my district and hold town halls along the way. And, I hike Big Bend every year. I wasn't worried about a 25-mile walk, but halfway through it, I started to feel nauseous and fatigued. I threw up multiple times during the walk. When I finally finished it, I don't know how I finished it, but I did. And when I got home, I thought all I needed was a good night's sleep because I figured I was just dehydrated. But I ended up sleeping for 36 hours. And so my family got concerned. They rushed me to the emergency room where nurses checked my blood sugar. I don't think I'd ever had my blood sugar tested before. And a normal blood glucose level is below 100. Mine was 900. And I was in a state of diabetic ketoacidosis, which is a life-threatening condition that leads to coma and death without insulin. And so I was diagnosed with type 1 diabetes on the spot and spent 5 days in the ICU and thankfully made a full recovery.
I thought it was interesting the timing of your diagnosis because that was the same year that I was diagnosed with type 1 diabetes. And, I've also dealt with some of those cost issues because I wear an insulin pump and have a blood glucose meter, which aren't always covered by insurance too. So there's a lot more to think about beyond just insulin.
That's exactly right. And I was so thankful that you reached out and shared your story as well, Josh. And it should just go to show that this disease affects anyone, and it happens to you, even if you're a healthy young person like both of us. And that just underscores the need to make sure that we are guaranteeing healthcare for everyone in this state, no matter who they are, no matter how much money they make, no matter where they come from. And as you mentioned, this is a complex problem. Thankfully, the bill that I filed doesn't just cap the out-of-pocket costs for insulin itself. It also caps the out-of-pocket costs for insulin supplies, whether it's needles, whether it's sensors or meters, as you mentioned. So we are trying to be as comprehensive as possible, but this is just a step toward our eventual goal, which is free insulin and free insulin supplies for Texans with diabetes.
Representative Talarico will be following your bill. Thank you very much for joining us.
Thank you for covering it.
Calls for more compassion at the Capitol.
It changes your whole trajectory of life.
How state lawmakers are responding to new pleas to make more people eligible for the state's medical marijuana program.